Hi, I'm Joel Ferris, and this is your 1 minute long term care planning moment. Let's start with the basics. What is long term care, and why do I need to plan for it? Long term care is defined as a chronic care event of 90 days or more. You're not necessarily getting better, but you're not necessarily getting worse. It covers severe mobility issues and memory issues to be able to live independently. Statistically, 70% of us will need some form of long term care in our lives. Most of us desire, if at all possible, to be able to live in our own home as we age. The question is that going to be possible if we haven't planned in advance for our long term care needs? Is it realistic also to assume that an adult child, a spouse or partner, or possibly even a neighbor or friend would be able to provide full time care for you when you age? Uh, Probably not, at least not full time. The question is, what are our options for long term care? Number one, you have the possible option of being able to private pay. If you happen to have a set aside of a substantial amount of money that's easily available, then that could be an option. But keep in mind that there have been things like the 2008 stock market blowup that severely damaged a lot of people's portfolios. You never know when that kind of thing could happen. Also, it can be a potential taxable event to take that money out as you need it. Secondly, there's the option of family members maybe tag teaming to provide care. But boy, without checking that out in advance with your adult children or whatever, in this mobile society, that may not be a realistic option. Number four is government programs. Medicare is not a long term care option. Medicaid is a long term care option, but it involves a spend down of your assets. So that is potentially problematic for your spouse unless you plan very well in advance. Number four is a private long term care insurance plan. Now, these cover in home care, assisted living, and nursing care. They also cover mobility issues. They call it custodial care, and also semi skilled nursing care for home care needs. Uh, and, um, and that could potentially be a realistic option for many people. If you can't health qualify for that type of plan, there are also ancillary products that are available to take care of folks that can't health qualify. We will cover more of these issues going forward in some of the 1 minute videos, so keep in mind as you go forward here that there's a lot to discuss, obviously. At this point, thank you very much for joining me today. Appreciate visiting my website and be sure and take a look at some of the resources on it. And at this point, thanks for joining us. Bye bye.